Smoking, drinking, and eating delicious food that's rich and fattening. Now, my next guest is battling not only those temptations, but social pressures linked to a serious disease. And now his wife may be on the same path. Take a look.
My husband, Corey, started having leg pain. Something wasn't right.
I was diagnosed with type 2 diabetes almost 2 years ago. It is 229. It's high, but it's not like through the roof. I was nervous and scared because a lot of people die from being a diabetic. April is very supportive, but annoys me. I tell her I'm taking my medications, but she's still concerned.
Did you test your blood today? My concern is that Corey continues to smoke cigarettes and drink alcohol.
When I make my drink, my wife is adding more juice to my vodka when I'm not looking.
When Corey turns his head, I add cranberry juice or orange juice to his drinks. I add more juice so he wouldn't have so much alcohol. Corey's struggling with eating properly, and I play a big part of that because I do majority of the cooking. My doctor just recently told me that I'm pre-diabetic. It's very stressful having to monitor our daily food intake.
What are you making?
Some fish and vegetables and some mashed potatoes. Put some more fat into your diet.
Sometimes I feel like my life is not normal. When we go out to our family functions, she will mention to everyone that I'm a diabetic. I do feel left out at times, not being able to eat certain things. It was my fault that I have diabetes because of the amount of sugar that I consume over time. I was told that if I eat healthier, that I would not have diabetes. This is annoying and irritating to have to watch what I eat. I try to change my eating habits, but it's hard.
Well, Corey and April are joining us along with our really good friend, a favorite of mine, Dr. Freda Lewis-Hall, Chief Medical Officer of Pfizer, so welcome. We're talking about type 2 diabetes today and the social stigmas that go along with it. And there are often misconceptions when people don't really understand this disease. So tell us about type 2 diabetes.
It is when the body's blood sugar increases above normal. Now, Corey is one of 29 million people in the US that have diabetes. And April is one of 86 million people in the United States that have prediabetes. These are not small numbers. One of the things that happens is people were like, well, all these tens of millions of people with these diseases, how serious can diabetes really be? So they don't think of it as a serious condition. But diabetes kills more people than breast cancer and HIV/AIDS combined. People with diabetes have twice the risk of having a heart attack and 10 times the risk of losing a lower limb to amputation. In addition to that, it is a leading cause of blindness, kidney failure, to other really serious illnesses like stroke even. So this is a very serious disease. As if that isn't enough for people with diabetes to deal with, a recent study tells us that 50% of people with type 2 diabetes think that their disease has a social stigma attached to it. Half.
And April, are you embarrassing Corey at social events?
I guess I am because, I love my husband. I want him to be around. And a lot of our friends and family, they don't know that Corey has reached his limit. So I just want to make sure that he's safe.
Okay, so what bothers you most about having diabetes, Corey?
Well, just not feeling normal. Might be embarrassed a little bit. Just I can't be myself. I feel like even though I lost all the weight, I still blame myself for being a diabetic.
So what are some of the misconceptions? I mean, let's just clear some of the myths up.
If you're obese or if you're overweight and you have diabetes, it's your fault. That is a big misconception. The other one I mentioned earlier is a lot of people don't understand the seriousness of this. You become embarrassed, you feel that it's your own fault, you may become depressed or angry. That may lead to hiding it from people, not wanting to talk about it, withdrawing from social events.
The only way people are going to not react that way is to educate themselves. This hits close to home because I can tell you I am a type 2 diabetic. And I have been my entire adult life. It's such a lifestyle with me, I don't even think about it anymore. I don't wake up every morning and say, okay, I'm a diabetic, I gotta do this. It's just some of my lifestyle. And so I roll with it. It is just not something you should be ashamed about. I'm not ashamed about it. I'm a type 2 diabetic. There you go. I don't care. I mean, this is what it is. You just live with it.
Some things you can't control, and you said it. There are risk factors for diabetes, your family history. You mentioned that. In addition to that, your age is a risk factor. Your ethnicity is a risk factor. But there are a whole host of things that you can control. Your smoking, what you eat every day, when you eat every day, your level of physical activity.
Your concerns about being a pre-diabetic, you got to do the same things now that you would have to do then, right?
Correct. Well, yeah, I'm just more concerned because I lost weight over 2 years ago. And I'm like, I'm going back down the same path with the bad habits. And my concern is becoming a diabetic.
I heard you slip in those sugary cocktails you're making, right, April? You know, sneaking a little bit of extra in. You know, that may be an example of really good intentions, but may doing harm instead. So if you think about it, fruit juice has a lot of sugar in it. Adding those things may actually be adding calories and sugar to the diet. And so it's particularly important to put that whole life plan together, to take a step back, to sit down with someone who can help you look at your nutrition, balance some of the things that you really like, put them into your lifestyle so that you can continue to have them. It doesn't mean you have to give up everything. Prediabetes is a condition where your blood sugar is higher than normal, but not high enough to be diagnosed with diabetes. And it does not mean that you are absolutely going to get diabetes. You should get checked every year or so. You know, make sure that you stay close with your healthcare team, have it checked. A full third of the people who have diabetes, a third do not know it. Some people who are sitting and watching the show right this minute have diabetes or prediabetes and do not know it. I would love for people to go to gethealthystayhealthy.com. Take a look at what the signs and symptoms are of diabetes so that you can educate yourself about that. Go to your healthcare provider and see if you are one of those people that can begin to make some changes to get healthy, just like the two of you are.
Look, we want to hear from you. So go to drphil.com and send us your questions because she answers all kinds of things. I want to thank all of my guests today, especially Dr. Freda Lewis-Hall. We'll see you next time. Thanks so much.